Today on Champions of Care, we're talking about lower back pain, and in this segment, we'll focus in on treatment options. With us in the studio is Dr. Tejpaul Pannu, who is a board-certified neurosurgeon with offices in Dearborn. Welcome to the show, Dr. Pannu.
Thank you.
Dr. Pannu, when would someone go to a spine specialist for lower back pain?
Yeah, when conservative treatment has failed or is not effective, in the case of injections or physical therapy, at that point you may reach out to see a spine surgeon. Myself, I'm a neurosurgeon who does spine-related procedures as well. At that point, you would be referred to myself.
Let's talk about some of the more common lower back conditions and what causes that pain. Is arthritis a factor here?
Yeah, when we categorize people in those lower back conditions, we put them into three separate categories. The first is degenerative disc disease, which is the most common. The second is trauma-related back pain from a fall or from a motor vehicle accident, or osteoporosis. And the third is exceedingly rare, but tumor or infection.
And what is this thing called spinal stenosis?
Spinal stenosis is a result of the degenerative disc disease process, or arthritis, or the medical term spondylosis. As we age, our spinal column ages as well. That can result in degeneration of the disc and bone spurring, which ultimately can result in spinal stenosis.
Let's talk a little bit more about discs. You can have a ruptured disc, a herniated disc, a slipped disc. What's the difference and how does it manifest itself in different pain?
Well, in that those three different terms, they are synonymous with each other, though many MRI findings, people can have herniated discs which don't result in any type of clinical symptom. This is part of the aging or the degenerative process of the spine. There are times that it is significant and can result in sciatic pain.
Sciatic. Now that sounds like that other word I've heard, sciatica. What's that?
Right. Sciatica is a herniated disc that's pushing on a nerve root, which is resulting in leg pain.
So does it always result in leg pain?
Most of the time, if it's a herniated disc on a nerve root, it will result in leg pain.
Now, for someone with osteoporosis or arthritis, is that just a natural aging process, or can surgical treatments really help alleviate that pain?
For osteoporosis, or the natural degenerative disc disease, which is a term we use for arthritic aging of the spine, there are surgical procedures when people have not had effective pain relief from their conservative treatments, such as physical therapy or injections. Most of those treatments can result in effective and safe outcomes for patients.
And we just talked about a lot of different terms and causes of that pain, but the bottom line, if our viewers are watching and they have back pain, do they need to know what's causing it and what condition they have, or what should they do?
Well, I think the first step is to go to their primary care physician, who will then refer them out to a physiatrist and possibly a pain management consultant. If those two individuals find that the treatment is not being effective, then referral will be made to a surgeon.
And then how do you determine if someone experiencing lower back pain truly does need surgery?
Well, within the 3-month period, the majority of people will improve. There's about a 50% lifetime incidence of low back pain within the U.S. population. Of that 50%, 90% of people will resolve in about 3 months' time. Of the remaining people that don't resolve, those are the people that are considered for surgical treatment.
And when someone comes to you in your office with, maybe they've been referred by their primary care physician or a physical medicine and rehab physician, what are those first couple of visits like, and how do you approach the problem?
Yeah, I think it's a misconception that if you go into a surgeon's office that you will be offered surgery right away. Majority of the time we review what has been done so far, feel that effective treatments in the conservative options have been done, and then if any additional conservative options can be further recommended, we would do those first. You will follow along with your physician, your surgeon for multiple visits, and then if effective treatment is not resulting in good pain relief, then we talk about different surgical options.
And are there some things that patients should know when selecting a surgeon for their back pain, or how does that all happen, and how do you determine the people who will be best with my particular condition?
Well, I think you want to go to a facility that has a comprehensive spine services. Here at Oakwood, we have multiple surgeons, and we all do essentially similar procedures. But I think going to a larger facility such as Oakwood is an excellent idea.
Dr. Pannu, is there anything else that you think someone who's watching this show should think about or know about when they're taking those first steps in addressing their back pain?
I think there's a bit of fear in terms of back pain and the idea that people will require surgery. Most people require conservative treatment, and the majority of people, as I mentioned before, 90+% of people will actually never require surgery. So there's only a small percentage of the patient population that would actually require surgical procedure. Now, there are multiple surgical procedures that are available with new technology. Surgeries are safer and more effective, resulting in less pain as well as shorter recovery times.
Well, it sounds like there's a lot of options, a lot of talented clinicians who can help guide a patient through the process. So I guess the bottom line is, if anyone who's watching has some serious back pain, they should get up if they can, see their primary care physician, and take some action for that pain. Dr. Pannu, thank you so much for being with us on Champions of Care.
Thank you for having me.
After a short break, we'll talk more about lower back pain, and we'll learn about minimally invasive surgical techniques to get you back in action. Stay with us.